Welcome to everybody. Today we have with us Dr. Georgina Peacock. And Georgina, tell us a bit about what you do.
So, well, first of all, I'm a pediatrician, and I specialize in working with children who are not meeting their milestones, children who have autism spectrum disorders. And I'm also a mom, so I pay attention to milestones in my own children. And those experiences together sort of help me to work in my current position at the CDC, which is to increase awareness about developmental milestones and early warning signs of delay.
Wow, that's a lot.
Yeah, it keeps us busy.
We do these kind of interviews for parents, basically in Montana, to kind of learn about the resources that are out there. And when we heard about what was happening with this program with the CDC, we thought that was very critical because of the tools that it can provide parents. And can you tell us a little bit about, what parents really should know when they're, looking at their children as they're developing?
Sure. So we have a campaign, it's called Learn the Signs, Act Early. And what that means is you're supposed to learn the early signs of child development, and then if you're concerned about a certain milestone that your child isn't meeting, for example, most children turn to their name when called. If they're 10 feet away and I say Joey, then Joey should turn and look at me by about 12 months of age. And so if a child isn't meeting a milestone like that, then we would encourage a parent to talk to their child's doctor about that.
Okay. Are there some particular signs, at different ages? I mean, especially how early do you look for signs?
Okay. Well, so what we first look at, or what we ask parents to do, is not think about the things that their child might not be able to do, but the things that we expect at different ages. So we know that most children are smiling around 6 weeks of age. We know by 7 months of age, children are going to be able to do some back and forth conversation. So they might have some sound. They will have sounds. They may have babbling sounds like mama or dada, and they'll be able to talk back and forth. And that is an early indication that children are able to imitate what's going on, and they're learning how to talk with people. They're not saying words like we know words, but they're starting that language development.
So, say for example, if a parent, suspects that something is not right, and they, when they go to their physician and their pediatrician, what do they tell them?
So if they are concerned that their child isn't meeting a milestone, for example, if their child doesn't have 6 words by 18 months, then they can go to their doctor and say, I looked at some of the resources on the CDC website. It's www.cdc.gov/actearly. And I saw that most children are speaking words by 18 months of age, and my child is not. Can we explore what's going on? Or, I'm concerned, and I want to know what I can do next. And then, of course, the answer to that is, there are early intervention services. So there are they're called Part C services. They're run through the education department in many states, and they are mandated federally that children that are not meeting milestones should be able to get services to help them. In that case, an 18-month-old that's not talking, first they're going to do an evaluation, and then if a child qualifies for services, they might work with a speech therapist to help them with their communication.
What would you suggest to a parent? Because we hear from many parents that are concerned about their children and where do they go for resources. That sometimes their pediatrician might say, maybe we should wait, but the parent doesn't want to wait.
Yeah.
I mean, what would you suggest?
I think parents have a gut sense about these things.
Yes.
If they are worried about their child, they need to keep on that. They need to say, and maybe what that doctor needs is a little more evidence. Maybe they can print out a sheet. We have some interactive milestone checklists on our website where you can check off what a child is doing at different ages, different milestones, and maybe that piece of paper where you're sort of saying, I'm still worried about my child. We need to go a step further. We need to figure out what's going on.
Okay.
The other thing is to reach out to some of those family support resources like your organization, other parents that have gone through this together, because that power that they can get by talking to parents that have experienced the same thing can give them confidence to follow their gut.
Many of our parents use those web resources. I mean, it's really critical, especially in our state where we're very isolated, basically. Can you talk a bit about the parent resources that are on the website that families can use?
When we are, most of our resources tend to be the national resources, so they will direct you to Family Voices, or they'll direct you to Nietzsche, which is an organization that assembles a lot of resources that are state-specific around disability and family support. And then it's important for providers, it's important for the doctors and the WIC providers to also know what those local resources are, because like you said, I mean, each community is different, and so you got to figure out who is going to support families on a local level. Right.
And you said there's also resources for the physicians, for other public health providers. Can you talk a little bit about that?
There are. I think part of the reason why why physicians sometimes say wait and see is because they don't have all the information they need. And so we spend a lot of time in our campaign, and that's really my focus, is to improve the knowledge of healthcare providers about child development and about those resources that are out there. People on a local level can help with that as well. The parents and the early intervention providers can take that information to local physicians and say, hey, if you've got a child that you're worried about that has a delay, we can help you. And physicians tend to be very open to that. They don't always know the resources that are in their environment or in their community, and just that knowledge, I think, can improve referral to services.
That's fantastic. Now I want to switch gears and talk a little bit about autism.
Okay.
Autism, is a huge issue across the country, and we have parents coming to us daily, asking, what do we do? We need to do something now. I can't find resources.
Sure.
There's so many unknowns. What do you say about autism? I mean, first, what are some of the myths that that are out there and that parents really need to know at this point in time?
So autism or autism spectrum disorders are a group of disorders where children have problems with communication, they have problems with socialization, and they have unusual behaviors. For example, a problem in socialization might be not making eye contact, or not pointing to things to show their mom, like not pointing to something on the table and wanting to say, I want that. Problems in communication, such as not reaching that milestone of 6 words at 18 months or 2-word phrases at 2 years. And then the unusual behaviors can be things like flapping your hands or walking on your toes. And when I give those examples, it's important to realize that it's not just one symptom that's going to say, oh, you've got an autism spectrum disorder, but it's looking at the child as a whole and seeing that they have these problems in different areas.
And it's not a blood test.
No, and there is no blood test. There are a few conditions in which children have a higher likelihood of having an autism spectrum disorder. So like Fragile X, for example, about 1/3 of children with Fragile X also have an autism spectrum disorder. And that is, you can do the blood test for the Fragile X, but there's no blood test for autism itself. So there are many researchers looking at this. There are many people trying to figure out what the risk factors are. We know there's a genetic component to that. We know if you've had one child with autism, you have an increased risk for having another child with autism. But we know there's something else. There's some other things, whether that's an environmental trigger that happens before the baby's born or in those first few months of life. We're not sure what those are. the CDC has got a study looking at this. So the study to explore early development, and they're trying to look at those risk factors, look in the blood for hormone differences or for immunological differences, so allergy differences, and different things to try to figure out what's going on.
So what's key for, well, number one, evaluation, and two, intervention?
Mm-hmm. So, that's an interesting question, because there are really two things that are happening when you're worried about a child. The medical field is really driven to look for reasons why, and maybe things that they can treat, or maybe things that they can intervene with on a medical side. And then there's the education side of things. So usually, if you're worried that a child has an autism spectrum disorder, you're going to receive some early intervention services. So those are therapies to work on communication, to work on socialization, to look at some of those behaviors that children have. And that's going to be in the education realm usually. And then you're also need to seek help from a medical specialist. That's usually a developmental pediatrician, a neurologist, a psychiatrist, maybe a psychologist, sort of depends on the resources in your area. And they are going to be looking at some of the more physical symptoms that you might have. A lot of children with autism we know have lots of sleep problems, and so as a developmental pediatrician, sometimes I'm talking to the parents about sleep. And those things happen, so this educational component and the medical component should be going on at the same time, and they shouldn't be dependent on each other. So what we don't want to happen is that children wait to see the medical specialist to make an official diagnosis and haven't gotten any intervention, because the intervention system can start working on symptoms and behaviors and speech delay right away. They don't need a diagnosis to do that.
So, well, let's talk a little more about the medical side. Are there any particular issues with regards to autism on the medical side that parents should be aware of?
The biggest thing that parents talk to me about is sleep, I think.
Sleep, that's interesting.
And it seems to be that children either have, so some of the sleep part I think is behavioral. It's needing to understand how to behaviorally address that. For example, I have a friend who has a child with autism, and he said, my child just doesn't understand the social cues that he needs to go to bed, because we all want to go to bed. And so they've found ways to help him stay in his room and stay safe, even if he's not ready to go to bed. So that's sort of one issue. It does seem that there are a number of children with autism that have sort of a sleep disorder, whether it's falling asleep or staying asleep for a long period of time. And there are people looking at that. There are people trying to figure out what's going like that. The other thing parents talk to me a lot about is sort of nutrition. And, I think there have been reports of some children having differences in their bowel habits that are, and they also have autism. So difficulties, whether that's because they are pretty selective in what they eat and that's causing a change in their nutrition, or the other way around, is it the autism that's making things difficult. And so there are a number of ongoing studies that are trying to look at that, trying to look at some of those more medical parts of autism.
Okay. So is there anything, any good strategies to try, both the sleep and the nutrition side?
It's hard for me to tell you that, for a specific, every child has to sort of be looked at individually. Okay. There are those good things, sort of good sleep routines. Don't have a TV in the bedroom, have a routine before you go to bed. That can be different in different families, but doing something that you know, that is relaxing before you go to sleep. You don't want to be running around in the yard and then say, okay, it's time for bed. You want to maybe read a book or take a bath. Those kind of general sleep hygiene habits, you know, that we all should, behavioral,
just kind of behavioral
the
stuff.
things that we all should follow.
Just has to be more strategic, more rigid with a child with autism.
And then with food, you know, I think there are sensitivities to food. I think people with autism have those, and people that you know that don't have autism also can have sensitivities to foods. And so, looking at that from a practical or a common sense side of thing, and saying, okay, well, if there's something that really seems to bother a child or make them get tummy aches, well, maybe that's something we can not use for a while and see if the child's tummy aches get better. But using common sense when looking at these different things.
Okay. How about statistics? I mean, the studies that have been done. Do we have any idea on how well the interventions are working, prognosis for, you know, for kids who do have autism that are getting intervention these days?
You know, we know that, and this is really sort of stepping back and looking at early intervention as a whole. We know that if we get children into services early, we start early intervention as soon as possible, then children have the best potential to reach their full potential. And so the outcomes can be pretty variable. You know, I don't think that we certainly don't know everything about autism today, and we're learning new things every day. But we know if we can get children into services soon, we can support those families, then that's giving them their best chance.
Excellent. So what do you see for the future?
So, well, I think we're going to be learning lots of new things in the next couple of years. I think we're going to learn more about what those genetic components of autism are. I think we're going to learn more about intervention, and maybe, you know, there's a lot of people talking about how even though we know autism spectrum disorders are a range of disorders, we know there are children that seem to have different kinds of difficulties. So, for example, some children seem to be having more communication problems, whereas some of the children have more problems with behavior, or the unusual behaviors or repetitive behaviors. And I think as we are able to observe children better, and maybe what we're going to find out, I think, is that different interventions work better for different types of children. You know, I mean, that whole idea that we individualize things.
Exactly.
One child with autism is one child with autism. They're not like the next child with autism. And so looking at those individual needs of that child is important, and I think we'll learn a lot more about that over the next couple of years.
So do you think there's anything that's really key in the research that's being done right now?
You know, I think the thing that strikes me as being very interesting is this whole idea of joint attention. So joint attention is...
What is that?
Well, I'll explain that
Okay.
to you. So if I'm looking at you and I point over here and I say, look at the picture on the wall.
Over there.
Yeah, you're gonna be looking at me, you're gonna follow my point to the picture, and then you're gonna look back at me to see what I do next.
Oh, okay.
That's joint attention.
Okay.
And children with autism don't do that. So children don't join in that interaction. They don't have that engagement with other people. And that's how we learn about our world. And so there's some really early research that's going on with really young children that are considered at risk. For example, children that may have an older sibling with an autism spectrum disorder, and they're working on looking at, can we teach this joint attention? Can we teach children who don't naturally do that? And I think that's a very interesting topic to look at. Yeah.
That's very interesting.
Yeah.
Well, we're getting to the end of our time. Is there anything in particular that you would like to say, or that you think parents need to know? And this is your chance. We have all these people that are going to be watching. So.
You know, I think the messages of our campaign are just sum up what I think is important. So learning the signs, learning about child development, learning about what every child should be doing or what you expect, learning the early warning signs so that if you're worried about your child, you act on those. So following your gut. If you're worried about your child, follow your gut, find out where your support is, talk to other families that have gone through this, because if you can get children into early intervention, they can do, they can reach their full potential, and that's what we're trying to do.
Wow, that's exactly what we do.
That's so, great. Well, yeah.
That's so just common sense.
Yeah, it's wonderful to be here. I mean, it's wonderful to see people doing this, out on the front lines, helping families and children so that they get the services they need.
Well, we really appreciate you coming to Montana. What do you think? You've been here less than a day.
Yeah. Well, I actually left Atlanta with rain and came here and it was rain. It was just colder. So, it's beautiful. It seems like a beautiful state, and I'd love to come back.
Well, we'll bring you back someday.
Okay.
Well, thanks for coming, Georgina.
Yeah, thank you.
Okay, and thank you for being with us today.